I'm VJ Hamilton and welcome to the Autoimmune RESET, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to today's episode of the Autoimmune RESET podcast. I'm your host, VJ Hamilton. I'm a nutritionist, scientist and expert in autoimmune disease. And today I want to explore the role of vascular health in alopecia areata. But today's episode will be focused specifically on alopecia. But the truth is, some of the concepts that I'm going to be talking about today are relevant for lots of different autoimmune conditions. I may have told this story before, but years ago I spoke to a professor who was working on different medications for multiple sclerosis, and he didn't believe that multiple sclerosis was an autoimmune condition. He saw it very much more of a vascular issue, and that those with multiple sclerosis had something called hypoxia, which means that the oxygen isn't able to get to the spine and the brain, and that can cause lesions and destruction. And that's really what causes multiple sclerosis rather than it being an autoimmune condition, which is an interesting theory. And I expect that it has some truth to it. I mean, he's a professor researching it, so I'm sure he knows best. But he was, investigating lots of different ways that would improve vascular health for people with multiple sclerosis. And I expect the same can be said for alopecia areata as well, because a lot of the time we look at alopecia as an immune condition, which it 100% is. But I think with any autoimmune condition, you need to understand why the immune system has decided to attack self-tissue. And I don't think it's as simple as the immune system gets confused. There are definitely mechanisms at play, and I think the role of the cardiovascular function and our vessels are absolutely key to this, because they provide the nutrients that are needed for the hair follicle to grow the hair. But not only that, with the hair follicle in particular, there is a site around the hair follicle that should be protected from the immune system. And when it isn't, that means that the immune system can start attacking the hair follicle. And I suppose the theory is that if the nutrients aren't getting to the hair follicle, and there is a thing called oxidative stress, where there are more free radicals producing antioxidants, that can create inflammation, and that can create the destruction of the hair follicle. So there is definitely a link between the two, and this concept doesn't just relate to alopecia areata. It could relate to lots of different autoimmune conditions, and one in particular is multiple sclerosis. However, today we are going to really be zoning in on the link between alopecia areata and vascular health, and also talk about things that you can do to help your vascular health, to promote healthy hair growth. With any condition, supporting vascular health is going to be extremely beneficial. I know in my family I have some genetic susceptibility, certainly to autoimmune conditions, but there is a lot of people in my family who have cardiovascular issues as well. And actually there was some research done by NYU Langone Health, and it showed that those with alopecia areata are at risk of developing heart disease, which I think is an interesting statistic, because ordinarily we see it as an immune dysfunction and we see it as hair loss, but we don't see the link with our heart and our cardiovascular function. And in that study, patients with alopecia areata were seen to have a 7-fold higher risk of heart attack or stroke. And I'm certainly not telling you that to scare you, and there are lots of different reasons why this study showed those results, especially the inflammatory response that can be a risk factor for both conditions. But it's just worth knowing that when we have some insight into what's going on in our body, whether through our skin, through our hair, through our nails, it's worth actioning that, because there could be other things that could happen down the line if we're not proactive about that. And that's how I always help with my health anxiety that I generally have. And that's probably what prompted me to get into this field and to help other people in this field, because I know what it's like to live in that constant fear that things aren't going right with your health. But what I like to do is to be proactive, have a plan, and empower myself with health knowledge as well. And that's not for everybody. I think it depends on your personality type, whether you want to do your own research. But you are listening to this today, so you obviously would like to learn more, and that's what I'm going to go through. But as I said, I see it in my family that we seem to have this genetic predisposition to both autoimmune conditions and cardiovascular issues. And obviously the research is supporting that as well. So if you're not familiar with alopecia areata, then this is a autoimmune condition that primarily affects the hair follicles. And as I said, there is emerging evidence now to show the link between this as an autoimmune condition, but also cardiovascular health. With anything that's to do with your vascular health, there is definitely a link with chronic inflammation, oxidative stress, and endothelial dysfunction, which is dysfunction of the vessels. One autoimmune condition called vasculitis is a specific autoimmune condition which attacks the vessels, and it's quite systemic in nature because we have our vessels everywhere. But there is a link there as well with autoimmune conditions and vascular health, with a specific autoimmune condition. So there are some underlying factors that are probably both present in alopecia and vascular issues, such as elevated inflammatory markers. You may experience dyslipidemia, where you have high cholesterol or even low cholesterol, and impaired endothelial function, which normally shows up as high blood pressure or issues with your blood pressure generally, but generally high blood pressure is when you're doing more damage to your vascular health. And I see a lot of clients who will come to me with an autoimmune condition, but they have a lot going on with their cardiovascular function as well. So we work on their cardiovascular function as well as their autoimmune condition to help them with their symptoms, and that's how they see relief. And I would say to anybody who has a genetic susceptibility to cardiovascular risk to get this checked, because it's important to get ahead of it with any of these types of conditions, because there can be destruction of the vessels, and you want to prevent that as much as possible. So if you do have a family history, it's certainly worth looking into. I've had a heart scan and had my cardiovascular health looked into previously, and it's worth doing that if you can. So what I thought was quite interesting is a common symptom that I see in alopecia areata, but is also a symptom of cardiovascular issues, and that is issues with the nails. So a lot of people will come to me and they will say the first sign of alopecia was that they had an issue with their nail health, especially things like nail pitting or spoon nails, when you have vertical lines in your nails, which are called bew lines. They can all be signs of an inflammatory condition, or certainly I see a lot of clients seeing that before they experience some hair loss. So always check in with your nails, and if there's something going wrong there, then it might be time to reflect, have a look at your diet, have a look at your life, and make some changes. And I love that about the body. It gives us these little signs that things are out of sync, and from that we can then do something about it, which is where nutrition and lifestyle changes really come in. And you can also go see your doctor and speak to your doctor about it and see if there's anything that they can do to help you as well. But yeah, nails are often pitted, or you can have lines in them, and that can relate to also cardiovascular functioning, because if the nutrients and the circulation isn't getting to the end of the fingertips, like if it isn't getting to the scalp, then it can cause these types of presentations. So it's worth just checking in with your nail health. Here are some of the common signs. So you may have nail pitting, which refers to like little dents or depressions in the nails. Normally when you see a dermatologist, they will check for this if you have alopecia areata. And I remember when I first went in to get mine checked when I was very young, but I do remember them checking my nails. There is also spoon nail. So this is a condition where the nails have a concave or spoon-shaped effect. Often they have raised edges, and that can be a sign of iron deficiency anemia. And again, that's very much linked to our vascular health and our blood health, and also alopecia areata. So if you notice that on your nails, and again, that might be worth looking into, you can have a test for your iron levels. There's also the blue lines, which are the horizontal lines or indentations that appear on the nails. And that can occur for many different factors. It can actually be a result of having an infection, because it's kind of showing you a moment in time in your health. But the presence of those lines may reflect an increased disease activity at the time, or lots of stress, and obviously that can impact your hair health as well. And then the last one is these splinter hemorrhages, which are tiny little blood clots that appear as thin reddish brown lines under the nails. And you can have those for various reasons, again, through trauma or infection, which are both risk factors in our vascular health and alopecia. But they have been seen in individuals that have vasculitis or autoimmune disorders. Because your vascular health is linked to alopecia areata, if you do have those and you have experienced hair loss, then it might be something to look into, because I'm talking to you today about vascular health in alopecia areata, but this won't be the only thing. And there are lots of different ways that the body can create an autoimmune response. So I hope you're not going to listen to this episode and think, okay, I've got alopecia areata, I've got an issue with my vascular health. That's not the case at all. This is just one avenue to explore. There are certainly lots of other avenues to look into as well when it comes to alopecia areata, but you don't want to miss this. If your vascular health isn't as good as it could possibly be, then it's going to be very hard to get the blood flow that you need and the nutrients that you need to the scalp to help regrow the hair. And that's why this is extremely important in alopecia areata and other autoimmune conditions as well. So let's talk about how cardiovascular issues can be a risk really for someone who is susceptible to alopecia areata. Well, the obvious one is that it can cause poor circulation. So we need to make sure the circulation is getting to our extremities, including our scalp. And when we're getting inadequate flow to the hair follicle, then that may weaken hair growth. And I find a lot of clients will get to the point where they're out of their flare, they've stopped shedding hair, they've got the patches, but they're just looking to grow their hair back as soon as possible. And that's why circulation is extremely important. I think when it comes to alopecia areata, there are definitely two phases. You have the flare phase where you're looking at suppressing the immune response as much as possible because you're hoping not to have any further damage to the hair follicle. And then once that flare is over, you then want to focus more on eating lots of nutrients and helping with circulation to get the hair growing. And actually, I don't think there's any harm in doing both as long as one doesn't cause an issue with the other. The other thing is that actually certain scalp conditions, such as even psoriasis, and there is a link between psoriasis and alopecia areata, can be associated with both cardiovascular risk and hair loss. For example, obesity, stress and inflammation are common risk factors in cardiovascular disease, and they can actually exacerbate scalp conditions as well. So if you have a lot of stress in your life, if you are currently a higher weight than you should really be and you are looking to find ways to lose weight, that is going to be helpful when it comes to your vascular health, but also your hair health. Now, I touched on stress. I mean, stress is such a huge factor when it comes to any condition, but especially with hair loss. I often find clients will come to me with alopecia and they have been through a fairly traumatic event or a life-changing event, and then they experience hair loss. Where I wanted to get to and where I want my clients to get to is a place where you can go through that type of stress but be resilient enough to not experience hair loss, even though you have that genetic predisposition to it. But if you are constantly living in chronic stress, that is going to make you more susceptible to vascular issues and also hair loss. dependent on what triggers it. Sometimes stress is the trigger. Sometimes what the stress is doing is suppressing your immune system, causing issues with your gut health, because when you're chronically stressed and in fight or flight, your body is not prioritizing your gut health. So there are lots of different reasons why stress can affect hair growth, and actually the stress hormone cortisol can impact the hair growth cycle, and it can also impact other hormones in the body. Thinking about how you're feeling and working on that either through like key nutrients or preferably lifestyle factors is going to help you when you are looking to grow back your hair. And probably quite an obvious point, but nutrient deficiencies are going to be an issue with both cardiovascular health and hair health, because you need those key vitamins and nutrients not only to be able to grow hair, but also they act as cofactors in lots of different reactions in the body, including keeping your immune system in check. And when you are nutrient deficient, all those different systems can go out of sync, and that's when we have this inflammatory response or autoimmune response that causes the destruction at the hair follicle. So I just wanted to touch on a few key areas when it comes to vascular health, which may be important when it comes to alopecia areata. The blood vessels are lined with endothelial cells, and there is something called VEGF, which stands for Vascular Endothelial Growth Factor, and it signals proteins involved in angiogenesis, which is just the formation of new blood vessels from pre-existing ones. So it can be extremely important when you are looking to improve circulation, but unfortunately, because it is something that promotes growth, it obviously has negative connotations as well, and it is involved in the inflammatory response. So in the context of alopecia areata, VEGF can actually play a role in the pathogenesis, so the creation of the condition and the progression of the condition, and that's what research has looked into. But from the other perspective, VEGF might actually be quite helpful because it helps with the growth of these key blood vessels, and without them you might not be able to get the nutrients to the hair follicle. So it's quite a confused area when it comes to alopecia areata, because VEGF is also involved in the inflammatory response. So you can see when you're in that flare-up, something like VEGF probably isn't the most helpful, and they have observed that in those with alopecia areata, they have an increased expression of VEGF on the scalp. And I know a lot of my clients will tell me that their scalp feels hot, their scalp feels itchy. I certainly knew when I was in more of a flare state to when it almost went in remission, even if I didn't have the hair growth at that point. But it might be to do with the expression of VEGF. So when you're in that flare state, maybe VEGF isn't going to be that helpful. But what they are looking at is how VEGF might help to play a role in promoting hair growth. So at one point, when the immune system is fired up, VEGF might not be as helpful because, as I said, it's involved in that inflammatory response. But research is now looking into how it could possibly play a role in promoting hair growth. And I think that's the confusing part of alopecia areata, especially if you have had alopecia areata for a long time or you've experienced hair loss for a long time. And I know a lot of people who have alopecia totalis or alopecia universalis, where they have lost all their hair, embracing it, enjoying life and not thinking about it anymore. And that's probably because they are out of that flare. Their health is pretty good now. And actually to get the hair to grow back, it may take a huge amount of effort, or it may even just not happen. But it doesn't mean that they're in that flare state all the time. It just means the damage was done. I always think that it could potentially be reversible, because that is the truth with alopecia areata. As long as the hair follicles have not been completely irreversibly damaged, which often isn't the case with alopecia, there is some hope that you can grow your hair back, but they are looking into how VEGF might help with that, because if you think about it, it's helping with the circulation get to the hair follicle. So when you are out of that flare state, it could potentially be helpful. And there have been studies that have shown that VEGF expression is upregulated in the hair growth phase, so that anagen phase. And remember, there is this hair growth cycle, which is in 3 to 4 different stages, and it can be quite frustrating when your hair falls out, because you might need to wait 3 months to grow it back, because you need your hair follicle to be in that anagen phase for the hair to grow back. And that's where VEGF might help. And there are lots of different nutrients that you can take to help to promote VEGF, but they are continuing with the research into the potential therapeutic target of VEGF for alopecia areata. But I just wanted to mention it because it is key in your endothelial health and your vascular health, but it also has these negative effects as well in the body, and you just need to be careful. I think that's with anything. There can be huge benefits to some nutrients, but it depends on your current health status, your genetics, and actually whether you're in a flare or not, of whether they're going to be helpful for you. So it's just worth always bearing that in mind. And I think with VEGF, dependent on your your health and your genetics, this could be helpful to help grow your hair back. But if you are very inflamed, if you have done testing and you have inflammation in your body, then it might not be the right thing to do, because it can fire up the inflammatory response. I also just wanted to touch on nitrates, because nitrates play a key role in blood circulation. Obviously, part of this is making sure that the blood is getting to the scalp with those nutrients and getting to the key areas. And nitrates are found in foods. They're found in vegetables like spinach, rocket, beetroot and leafy greens, and they've been shown to have potential benefits for cardiovascular health because of their effects on your blood vessels and circulation. So nitrates are converted into nitric oxide in the body. And all you need to know about nitric oxide is it's important to help with vasodilation, so helping to widen the blood vessels and improve blood flow. So if somebody has high blood pressure, this might be something to look into for them, because often with high blood pressure, it's when the blood vessels are constricted, whereas this is helping with vasodilation. So in the context of alopecia, it's important to optimize blood flow to the scalp, because obviously that's where the hair follicle is. And there isn't a huge amount of evidence to support the role of nitric oxide in alopecia areata, but it just makes sense theoretically that if we are improving blood flow to the scalp, then that is going to help us with hair growth. So there are a number of ways that a nitric oxide could help with hair growth. As I said, it helps to enhance blood flow to the scalp. It also has anti-inflammatory properties, and we know inflammation is a key part of alopecia areata and autoimmune conditions, so it may help to reduce inflammation in the scalp tissue, but it also helps to provide the delivery of those nutrients and oxygen to the cells in the hair follicle. Probably haven't mentioned that enough, that actually there are cells all around the hair follicle that need energy, and if you're not producing enough energy, then you are not going to be able to grow hair. So that's a key part of this as well. Cellular health plays into so many different conditions, especially autoimmune disease, because if something is going on in your cells and your immune system is targeting something that's dysfunctional in those cells, then you're going to have this inflammatory response in the body. Now, I wanted to talk about nitrates because it's easy enough to go out and eat lots of nitrate-rich foods, but the interesting part about it is that the conversion of dietary nitrates to nitric oxide actually begins in the mouth. This is, again, another concept to really think about. You can be eating all the right foods, but if you're not breaking them down properly, then that's going to create an issue for you, because you're probably not getting the key nutrients from some of the foods you're eating. And that's why doing something like a stool test can be extremely helpful, because if you don't have certain gut bacteria or you're not breaking down protein as efficiently as you should be, then that's going to have a knock-on effect to lots of different areas in your body. And if you're susceptible to alopecia or autoimmune conditions, then that may trigger that response. And they showed with nitrates that in order to convert them, there needs to be an enzyme called nitrate reductase that converts the nitrates in food to nitrates. And that happens in the mouth through some key beneficial bacteria that are residing in the mouth, and they help to break the food down. So again, this goes back to you need to chew your food 30 times. Every bite of food needs to be chewed 30 times. I would, after this podcast, when you are eating your next meal, count how many times you chew your food, because this could just be a very simple thing that you could start doing that's going to improve your vascular health. Now, after you swallow your food, then there is further conversion of nitrates when they enter the stomach, and that's when they're converted to nitric oxide. And again, you need to have certain gut bacteria present and gastric acid to help with this process. And one of the key bacteria is lactobacillus. And lactobacillus is a beneficial bacteria which has a huge amount of research behind it. And I have noticed recently when I've been reviewing some of my clients' stool test results that they don't have any lactobacillus, and they might not have had any lactobacillus in their gut for many years, and I expect that is contributing to a lot of their symptoms. So there are some easy fixes for that. It's worth understanding this point that if you don't have gut bacteria present, you might not be able to break down your foods appropriately. It's not always reliant on certain organs like your pancreas, gallbladder and liver. It's reliant on the microbes inside us to do this job for us. So as I mentioned, you get nitrates from foods. These can be found in lots of different fruits and vegetables, but you can also find them in cured meats. But obviously, if you have any vascular issues, you might not want to be eating lots of cured meat. So I would eat those nitrate-rich vegetables. And if I feel that my clients might need a bit of help with their circulation or their vascular system, or they might be having things like Raynaud's or other symptoms that relate to vascular issues, then I'll often tell them to drink some beetroot juice daily, and that can really help. And actually, beetroot juice can also help with your athletic performance. So if you are training for anything, then it might be worth incorporating that. So let's talk about some of the testing that you can do for your vascular health. I run a test in my clinic called the cardiometabolic test, and it really goes through lots of different markers, because the truth is it's not all about cholesterol, and that's normally what you get tested at your doctor's. You need to look at some other markers to understand exactly what's going on in your cardiovascular health. One of the places to start is probably going to be high sensitivity C-reactive protein, which is a marker for inflammation. So inflammation of the vessels is definitely one of the main drivers in cardiovascular disease. So it's worth checking your inflammation marker in the first instance, but in combination with your cholesterol, here are a few other markers which are tested on that cardiometabolic test, which I run quite frequently for my clients who have a genetic susceptibility to cardiovascular issues, or they have high cholesterol, as well as having an autoimmune condition. So the first one is adiponectin, which is a protein hormone produced by the adipose tissue, and it plays a role in regulating glucose metabolism and fatty acid oxidation. So it's helping to keep your blood sugar in balance, and they have shown that higher levels of adiponectin are associated with improved insulin sensitivity, which means that your cells are more able to regulate your blood sugar. So you're going to have more tolerance to carbohydrates, more tolerance to sugary foods, and your body is going to be able to utilize energy from the food you eat much better. So it's good to have a high amount of this. However, lower levels are linked to insulin resistance, obesity and type 2 diabetes, and also the risk of having a cardiovascular event. So it's a really interesting marker to check in on, especially if you find that you are getting lots of symptoms of blood sugar dysregulation, like lots of highs and lows during the day when it comes to your energy, or you might have had a high blood sugar score from your doctors, your HbA1c. So you can check in with that as well. But this is just a really good marker, and unfortunately your doctors don't ordinarily test for it. The other one is very low density lipoprotein. So that is VLDL. So you might be aware of LDL as a cholesterol that you would check, but actually very low density lipoprotein is a better marker when it comes to looking at whether your cholesterol is going to be harmful or not, because elevated, when it's very low density lipopolysaccharide, it's more likely to create issues in the vessels, which can lead to cardiovascular disease. So again, you might not have any symptoms, but it's worth knowing what your levels are, because outside of just testing for LDL cholesterol, HDL cholesterol and total cholesterol, knowing your VLDL cholesterol is going to give you better insight into whether you are more at risk of vascular issues. And then last but not least, because there are lots of other markers on this test as well, but I just wanted to pull out some key ones, is something called lipoprotein associated phospholipase A2, which is also referred to as PLAC, PLAC, and that's an enzyme produced by inflammatory cells in the atherosclerotic plaque. So often when people have cardiovascular issues, they have plaques in their vessels or in their valves, and that creates an issue. And this can detect whether you have elevated levels of plaque and whether you have an increased risk of the health issues that are associated with plaque. So again, a really good marker to check if you feel you have a genetic susceptibility to heart disease. And I would just say anybody who has a risk of cardiovascular issues in the family, it's definitely worth looking at these extra markers when it comes to your health. Now, lastly, I just wanted to touch on some of the foods that can help with cardiovascular function. And when it comes to healthy foods, you may listen to some of the podcasts and be like, VJ's saying all the same things all the time. And the truth is, when you are working on your health, you can specifically focus on working on your vascular health, but that's going to help with your immune health and your hair health as well. I'm just going to touch on a few things that I would recommend incorporating into your diet daily to help with your vascular health, especially if you have symptoms of issues with your cardiovascular health, like cold hands and feet, or if you have different bruising, or even having issues with your toenails or nails. So you may have Raynaud's, you may find that your wounds aren't healing very well. These are all symptoms of cardiovascular issues. Eating lots of antioxidant-rich foods are going to be beneficial. Have those, berries daily if you can, a handful of berries. I like to buy the frozen berries. I keep them in the fridge, and I will have them either in a smoothie, or I'll top them on my breakfast. I'll have them with kefir. There's lots of different ways that you can incorporate berries into your daily routine, just a handful a day, and try and get a variety of different berries if you can. You can also have lots of cruciferous vegetables. I generally eat cruciferous vegetables daily. I'll either have broccoli or Brussels sprouts or cauliflower or cabbage, and I just like to include that in my daily diet. And also citrus fruits are wonderful antioxidants. You can have lemon water in the morning. And I absolutely love grapefruit, and grapefruit is quite nice to have before eating because it can help with bowel production and help to stimulate gastric juices before you eat. So I think in the past, I remember my nana actually used to have a grapefruit before a meal. So I think she knew a thing or two before I, did this type of research. But yeah, it's good to have something like that, not just for the fact that it's an antioxidant, but it can help with your digestion as well. Next is, of course, omega-3 fatty acids, which are found in salmon, mackerel, sardines. I like to make sardines with lemon zest and coriander and red onion, and I'll just fry them up together, and I'll often have that with a salad or some quinoa. So that's just a really delicious, lovely lunch. You can also find omega-3s in flaxseed, chia seeds and walnuts, but just be aware that they are not as bioactive in the body. So look to incorporate omega-3s in your daily diet, not just weekly, but daily diet. You want to be consuming them. And then vitamin C rich foods. I mean, vitamin C in particular is extremely important for collagen synthesis, but wound healing as well, which is vital in your vascular health. And I know when I've been for testing in the past, I always seem to need a lot of vitamin C, and your body can't make vitamin C itself, so you need to keep replenishing that. And actually, if you have a high need for vitamin C, it's worth looking into other things, because there might be some chronic infections there which your immune system is fighting off, which is why you have a high need for vitamin C. But it is good to be eating vitamin C rich foods, and if you need to supplement, but obviously work with your health practitioner if you are looking at supplementing vitamin C. You don't keep it in the body for really longer than only 12 hours anyway, so there is less of a risk, but obviously if you have too much, it can cause digestive issues. So foods rich in vitamin C is, again, citrus fruits, so oranges, lemons and grapefruits. I know it's not great for everybody if you have gut issues, but strawberries are really high in vitamin C. It's a great time of year to be eating strawberries. Kiwis are lovely. I remember my mum used to force me to eat kiwis when I first got diagnosed with alopecia. I didn't even know what a kiwi was at the time. And broccoli is a really great source of vitamin C as well. And then those nitrate-rich foods could be helpful as well. So the beetroot, the spinach, the rocket, the leafy greens. I love my rocket salad. I will dress it with olive oil, balsamic vinegar, and I do some toasted pine nuts as well and throw those in. It's just really simple, but I just have it as a side dish to lots of different meals. So that's something that you can do. Outside of diet, you can stimulate VEGF production and vascular health through different lifestyle habits. And I'm sure you won't be surprised that regular exercise is key to this. That is going to help to stimulate blood flow, and especially for something like alopecia, where you're looking to get the blood flow to the scalp. But obviously not all of us are that mobile, and if that's the case for you, just do what you can do. But walking, jogging, swimming is going to be helpful, and cycling if you like cycling, but just find whatever exercise is best for you. And I find a lot of my clients who are fairly busy and have very interesting yet demanding lives, just find fitting in a 15-minute HIIT class where you're getting your heart rate up, and doing that daily can be helpful, especially if you are, looking to get your lymph flowing, to get your immune cells round, but also helping with your circulation. And I couldn't not mention the stress piece of this. I think it's key to all autoimmune conditions, but particularly alopecia areata. And stress can manifest in many ways. The reason we're chronically stressed is it can be very complex. It might not just be the case that you are having issues at work or that you are having issues in your family life. There can be so much more to it. And I think there's a lot of digging that often needs to be done when it comes to understanding why you're living in chronic stress. It can be based on your personality, and that you're very driven and motivated and you're putting yourself under pressure. But that can mean traveling back in time. Sometimes just looking at why you might be acting in the way you are acting. Obviously, there's some stresses that we can't control, and it's learning how to deal with those stresses in a daily life. And I think once we understand why something is causing us stress, then we can deal with it. But there are also stress management techniques that you can start incorporating into your life. There's lots of different meditation apps now, and I feel everyone can probably find one that is right for them. You don't have to do it every day for a long period of time. You could just do it for 5 minutes in the morning. I will wake up and do my meditation. That's the way that I'm able to incorporate it into my day, because as the day goes on, I just don't have time to do it at that point. You can also do deep breathing exercises. That is something that I will do throughout my day. And then something like yoga or Tai Chi might be it can really help to lower the stress response, but that might be something that you incorporate, say, a couple of times a week. And I love yoga, and I haven't done it recently, and I'm really craving it. So I think in the next couple of weeks, I'm going to start with my yoga practice again, because it is such a great tool for me anyway to help calm my body down. And I don't feel like any other exercise does that. So I hope you found the information today helpful. I know we've gone through a lot. We've really talked about 2 different conditions today, but I hope you've got something out of it. If you have any questions, then feel free to pop over to my Instagram account, which is at the Autoimmunity Nutritionist. You can also join my free group, the Autoimmune Forum, and ask some questions over there. I share information daily, really, and we have a great group of people who are, finding the best way to live with their autoimmune condition. And next week, I have the Nutrition Essentials for Healthy Hair Growth, which is specifically focused on alopecia areata and diffuse alopecia. So I'd love you to join that. That is next Wednesday, which is the 15th of May 2024. So I'd love you to be able to join that. After I've done the session, I'll actually link it here, but you will find the link to join that session in the show notes. I'd love to see you there. It's at 8 p.m. UK time. We're going to be going over the key nutrients for healthy hair growth, but also to help your immune system when it comes to alopecia areata. So I'd love to see you there. And the benefit of those sessions is the presentation is recorded, but we have 30 minutes to talk to each other, to go through lots of questions. So it's very interactive. And that's what I love about these sessions. It's not just about me giving you lots of information. It's about you asking questions and for us to understand what it means for, us and you personally, rather than just lots of information that is thrown at you. So I'd love to see you over there. If not, have a fantastic rest of your week and I'll speak to you soon. Take care. Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time, and remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.